Part 4. Points. 2. Points of stomach meridian of foot. Yangming. The stomach meridian starts from Chengqi, stomach 1, and is followed by other points located on the head, face, chest, abdomen, and the anterolateral side of the lower limbs. The last point is Li Dui, stomach 45. 19 commonly used points are selected and introduced here. Chengqi, stomach 1. On the face, right below the pupil, between the eyeball and the infraorbital ridge. Indications: redness, swelling, and pain of the eyes, lacrimation, optic atrophy, facial paralysis, and myopia. Puncture 0.2 to 0.3 cun. Moxibustion is not applicable. Sibai, stomach 2. On the face, right below the pupil, in the depression of the infraorbital foramen. Indications: redness, swelling, and pain of the eyes, facial paralysis, and trigeminal neuralgia. Puncture 0.2 to 0.3 cun and apply 3 to 5 moxicones, or 5 to 10 minutes moxibustion. Dicang, stomach 4. On the face, 0.4 cun from the side of the mouth, on the intersection of the sideline of the mouth and the horizontal line down from the raft of the upper lip. Indications: facial paralysis, salivation, and twitching of the eyelids. Puncture 0.2 to 0.3 cun or subcutaneously 1 to 1.5 cun with the tip of the needle directed towards jiache, stomach 6. Apply 3 to 5 moxicones or 5 to 10 minutes moxibustion. Jiache, stomach 6. On the cheek, 1 finger breadth, middle finger, anterior and superior to the mandibular angle, in the depression where the masseter muscle is prominent. Indications: distortion of the mouth and eye, mumps, toothache, and trigeminal neuralgia. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Xiaguan, stomach 7. On the face, anterior to the ear, in the depression between the zygomatic arch and mandibular notch. Indications: deafness, tinnitus, toothache, facial paralysis, mandibular arthritis, and trigeminal neuralgia. Puncture 0.3 to 0.5 cun, apply 3 moxicones, or 5 to 10 minutes moxibustion. Stomach 8. On the lateral side of the head, 0.5 cun above the anterior hairline at the corner of the forehead and 4.5 cun lateral to the midline of the head. Indications: headache, redness, swelling and pain of the eye, and dizziness. Puncture 0.3 to 0.5 cun and apply 5 to 10 minutes moxibustion. Stomach 18. On the chest, right below the nipple, on the lower border of the breast, in the 5th intercostal space, 4 cun lateral to the anterior midline. Indications: chest pain, cough, asthma, and mastitis. Puncture obliquely 0.3 to 0.4 cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Liangmen, stomach 21. On the upper abdomen, 4 cun above the center of the umbilicus and 2 cun lateral to the anterior midline. Indications: stomach diseases, distension, diarrhea, and obesity. Puncture 0.5 to 1 cun and apply 5 to 10 moxicons, or for 10 to 20 minutes moxibustion. Tianshu, stomach 25. On the middle abdomen, 2 cun lateral to the center of the umbilicus. It's the front mu point of the large intestine. Indications: abdominal pain and distension, constipation, diarrhea, irregular menstruation, edema, and appendicitis. Puncture 0.5 to 1 cun and apply 5 to 10 moxicons, or 10 to 30 minutes moxibustion. Guilai, stomach 29. On the lower abdomen, 4 cun below the center of the umbilicus and 2 cun lateral to the anterior midline. Indications: abdominal pain, dysmenorrhea, irregular menstruation, and amenorrhea. Puncture 0.5 to 1 cun and apply 5 to 10 moxicons, or 10 to 30 minutes moxibustion. Guan, stomach 31. At the anterior side of the thigh, on the line connecting the antero-superior iliac spine and the superior-lateral corner of the patella, on the level of perineum when the thigh is flexed, in the depression lateral to the sartorius muscle. Indications: pain in the thigh with difficulty in flexing and extending, and muscular atrophy of the lower limbs. Puncture 0.6 to 1 cun and apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Dubi, stomach 35. With the knee flexed, on the knee, in the depression lateral to patella and its ligament. Indications: knee pain and motor impairment. Puncture 0.3 to 0.5 cun or apply 3 moxicons, or 10 to 30 minutes moxibustion. Zhu Sanli, stomach 36. On the anterior lateral side of the leg, 3 cun below Dubi, stomach 35. 1 finger breadth from the anterior crest of tibia, He point of the stomach meridian. Indications: gastric pain, vomiting, abdominal distension, diarrhea, dysentery, constipation, mastitis, appendicitis, asthma, paralysis of the lower limbs, vertigo, headache, B syndrome, Wei syndrome, hysteria palpitation, cough, gastritosis, impotence, insomnia, diabetes, gynecopathy, obesity, drug addiction, and facial beautification. Puncture 0.5 to 1.5 cun and apply 5 to 10 moxicons, or 10 to 30 minutes moxibustion. Shangju, stomach 37. On the anterior lateral side of the leg, 6 cun below Dubi, stomach 35, and 1 finger breadth from the anterior crest of tibia. Indications: abdominal pain and distension, diarrhea, dysentery, constipation, and appendicitis. Puncture 0.5 to 1.5 cun and apply 3 to 5 moxicons, or 10 to 30 minutes moxibustion. Tiako, stomach 38. On the anterior lateral side of the leg, 8 cun below Dubi, stomach 35, and 1 finger breadth from the anterior crest of tibia. Indications: pain and paralysis of the lower limbs and frozen shoulder. Puncture 0.5 to 1 cun and apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Fenlong, stomach 40. On the anterior lateral side of the leg, 8 cun above the tip of the external malleolus, lateral to Tiako, stomach 38, and 2 finger breadths from the anterior crest of tibia. It's the Lu connecting point of the stomach meridian. Indications: vertigo, cough with profuse sputum, asthma, abdominal pain, diarrhea, constipation, mania, epilepsy, muscular atrophy, hysteria, and obesity. Puncture 0.5 to 1 cun, apply 5 to 10 moxa cones, or 10 to 30 minutes moxibustion. Chunyang, stomach 42. On the highest tip of the dorsal aspect of the foot, where the dorsal artery of the foot is palpable. It's the yuan primary point of the stomach meridian. Indications: atrophied foot and upper toothache. Puncture 0.2 to 0.3 cun and apply 3 to 5 moxa cones, or 5 to 10 minutes moxibustion. Neiting, stomach 44. On the dorsal aspect of the foot, at the junction of the red and white skin, proximal to the margin of the web between the second and third toes. It's the yin spring point of the stomach. Indications: toothache, pain in the face, facial paralysis, sore throat, epigastric pain, abdominal pain and distension, and constipation. Puncture 0.2 to 0.4 cun and apply 3 to 5 moxa cones, or 5 to 10 minutes moxibustion. Stomach 45. On the lateral side of the second toe, 0.1 cun from the corner of the nail. It's the Jing well point of the stomach meridian. Indications: toothache and dream-disturbed sleep. Puncture 0.1 to 0.2 cun, apply 1 to 3 moxa cones, or 3 to 5 minutes moxibustion. Points of bladder meridian of foot Taiyang. The bladder meridian starts from Jingning, bladder 1, and is followed by points located on the face, head, vertex, and both sides of the Du meridian, on the back, the midline of the posterior side of the lower extremities, and the lateral side of the foot. The last point is Jing, bladder 67. 26 commonly used points are selected and introduced. Jingning, bladder 1. On the face, in the depression slightly above the inner canthus. Indications: redness, swelling, and pain of the eyes, night blindness, myopia, and optic neuritis. Puncture 0.1 cun. Moxibustion is not applicable. Cuanzu, bladder 2. On the face, in the depression of the medial end of the eyebrow, at the supraorbital notch. Indications: redness, swelling, and pain of the eyes, headache, twitching of the eyelids, and facial pain. Puncture 0.1 to 0.2 cun subcutaneously with the tip of the needle directed towards Sizhu Kong, Sanjiao 23, or prick with a 3-edged needle to bleed. Moxibustion is not applicable. Tianzhu, bladder 10. On the nape, in the depression of the lateral border of muscle trapezius, and 1.3 cun lateral to the midpoint of the posterior hairline. Indications: headache and neck stiffness. Puncture 0.3 to 0.5 cun, apply 5 to 10 minutes moxibustion. Dazhu, bladder 11. On the back, below the spinous process of the first thoracic vertebra, 1.5 cun lateral to the posterior midline. Indications: neck stiffness, shoulder and back pains, and cough. Puncture 0.3 to 0.5 Chun, apply 3 to 7 moxicons or 10 to 30 minutes moxibustion. Fengmen, bladder 12. On the back, below the spinous process of the second thoracic vertebra, 1.5 Chun lateral to the posterior midline. Indications: common cold, headache, cough, asthma, and pain in the back and shoulder. Puncture 0.3 to 0.5 Chun, apply 5 to 10 moxicons or 10 to 30 minutes moxibustion. Fei Shu, bladder 13. On the back, below the spinous process on the third thoracic vertebra, 1.5 Chun lateral to the posterior midline. Indications: cough, asthma, chest pain, night sweating, and diabetes. Puncture 0.3 to 0.5 Chun, apply 3 to 5 moxicons or 10 to 30 minutes moxibustion. Jue Shu, bladder 14. On the back, below the spinous process of the fourth thoracic vertebra, 1.5 Chun lateral to the posterior midline. Indications: cardiac pain, palpitation and distension, and chest inflammation. Puncture 0.3 to 0.5 Chun, apply 3 to 5 moxicons or 10 to 30 minutes moxibustion. Xinshu, bladder 15. On the back, below the spinous process of the fifth thoracic vertebra, 1.5 Chun lateral to the posterior midline. Indications: cardiac pain, palpitation, cough, night sweating, epilepsy, and hysteria. Puncture 0.3 to 0.5 Chun, apply 3 to 5 moxicons or 10 to 30 minutes moxibustion. Geshu, bladder 17. On the back, below the spinous process of the seventh thoracic vertebra, 1.5 Chun lateral to the posterior midline. Indications: epigastric pain, hiccup, belching, difficulty in swallowing, cough, asthma, hypochondriac pain, and rubella. Puncture 0.3 to 0.5 Chun, apply 1 to 5 moxicons or 10 to 30 minutes moxibustion. Ganshu, bladder 18. On the back, below the spinous process of the ninth thoracic vertebra, 1.5 Chun lateral to the posterior midline. Indications: liver diseases, hypochondriac pain, redness of the eyes, headache, dizziness, epigastric pain, and hysteria. Puncture 0.3 to 0.5 Chun, apply 3 to 5 moxicons or 10 to 30 minutes moxibustion. Danshu, bladder 19. On the back, below the spinous process of the 10th thoracic vertebra, 1.5 Chun lateral to the posterior midline. Indications: bitter taste in the mouth, pain in the chest, and hypochondriac region. Puncture 0.3 to 0.5 Chun, apply 3 to 5 moxicons or 10 to 30 minutes moxibustion. Pishu, bladder 20. On the back, below the spinous process of the 11th thoracic vertebra, 1.5 Chun lateral to the posterior midline. Indications: epigastric pain, abdominal pain, fullness in the hypochondriac region, vomiting, diarrhea, edema, profuse menstruation, vertigo, insomnia, Wei syndrome, diabetes, malnutrition, and obesity. Puncture 0.3 to 0.5 Chun, apply 3 to 5 moxicons or 10 to 30 minutes moxibustion. Wei Shu, bladder 21. On the back, below the spinous process of the 12th thoracic vertebra, 1.5 Chun lateral to the posterior midline. Indications: epigastric pain, vomiting, poor appetite, diabetes, and malnutrition. Puncture 0.3 to 0.5 twin, apply 3 to 5 moxicons, or 10 to 30 minutes moxibustion. Shenshu, bladder 23. On the lower back, below the spinous process of the second lumbar vertebra, 1.5 twin lateral to the posterior midline. Indications: kidney deficiency, nocturnal emission, impotence, incontinence of frequent urination, retention of urine, lumbago, vertigo, tinnitus, deafness, asthma, diarrhea, dizziness, hysteria, Wei syndrome, diabetes, and facial beautification. Puncture 0.3 to 0.5 twin, apply 3 to 5 moxicons, or 10 to 30 minutes moxibustion. Changshu, bladder 25. On the lower back, below the spinous process of the fourth lumbar vertebra, 1.5 twin lateral to the posterior midline. Indications: soreness and pain in the lumbar region, muscular atrophy, pain and motor impairment of the lower extremities, and sciatica. Puncture 0.5 to 1 twin and apply 5 to 10 moxicons, or 10 to 30 minutes moxibustion. 次疗, bladder 32. On the sacrum, medial and inferior to the posterior superior iliac spine, just at the second posterior sacral foramen. Indications: gynecological diseases, nocturnal emission, impotence, enuresis, and hemorrhoids. Puncture 0.5 to 1 twin, apply 5 to 10 moxicons, or 10 to 30 minutes moxibustion. Weizhong, bladder 40. At the midpoint of the popliteal crease, between the tendons of muscle biceps femoris and muscle semitendinous. It's the Hexi point of the bladder meridian. Indications: lumbago, paralysis of the lower extremities, abdominal pain, vomiting, diarrhea, eczema, and pruritus vulva. Puncture 0.5 to 1 twin, or prick the point to cause bleeding. Apply 3 to 5 moxicons, or 5 to 10 minutes moxibustion. Fufen, bladder 41. On the upper back, below the spinous process of the second thoracic vertebra, 3 twin lateral to the posterior midline. Indications: stiffness in shoulder, back, and neck pains. Puncture 0.3 to 0.5 twin, apply 3 to 5 moxicons, or 10 to 30 minutes moxibustion. Gaohuang, bladder 43. On the back, below the spinous process of the fourth thoracic vertebra, 3 twin lateral to the posterior midline. Indications: pulmonary tuberculosis, night sweating, mild fever, cough, asthma, and nocturnal emission. Puncture 0.3 to 0.5 twin, apply 5 to 10 moxicons, or 10 to 50 minutes moxibustion. Zhishi, bladder 52. On the lower back, below the spinous process of the second lumbar vertebrae, 3 twin lateral to the posterior midline. Indications: nocturnal emission, impotence, enuresis, soreness and pain of the leg and knee. Puncture 0.5 to 1.5 twin, apply 3 to 5 moxicons, or 10 to 30 minutes moxibustion. Zhibian, bladder 54. 3 twin lateral to the sacral hiatus. Indications: pain in the lumbosacral region, muscular atrophy, motor impairment of the lower extremities, and sciatica. Puncture 0.5 to 1 Cun, apply 3 to 5 moxicons, or 10 to 30 minutes moxibustion. Chengshan, bladder 57. On the posterior midline of the leg, between Weizhong, bladder 40, and Kunlun, bladder 60, in the depression below the belly of muscle gastrocnemius, when the leg is stretched or the heel is lifted. Indications: hemorrhoids and sciatica. Puncture 0.5 to 1.5 Cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Feiyang, bladder 58. On the posterior side of the leg, 7 Cun right above Kunlun, bladder 60, and 1 Cun lateral and inferior to Chengshan, bladder 57. It's the lower connecting point of the bladder meridian. Indications: headache, blurred vision, lumbago, Wei syndromes, and hemorrhoids. Puncture 0.5 to 1 Cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Kunlun, bladder 60. Posterior to the lateral malleolus, in the depression between the tip of external malleolus and tendon calcaneus. It's the Jing River point of the bladder meridian. Indications: headache, blurred vision, neck stiffness, shoulder pain and lumbago, and sciatica. Puncture 0.3 to 0.5 Cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Shanmai, bladder 62. On the lateral side of the foot, in the depression directly below the external malleolus, one of the 8 confluent points. Indications: headache, epilepsy, motor impairment of the lower limbs. Puncture 0.2 to 0.4 Cun, apply 3 to 5 moxicons, or 5 to 10 minutes moxibustion. Zhiyin, bladder 67. 0.1 Cun lateral to the corner of the nail of the small toe, it's the Jing Well point of the bladder meridian. Indications: headache, eye diseases, and malposition of the fetus. Puncture 0.1 Cun, apply 3 to 5 moxicons, or 5 to 10 minutes moxibustion. Acupuncture is not recommended for pregnant women. Points of the gallbladder meridian of the foot, Shaoyang. There are 44 points on the gallbladder meridian, which starts from Tongziliao, gallbladder 1. It is followed by points on the head, chest, and the lateral side of the lower extremities. The last point is Zuqiaoyin, gallbladder 44. 13 commonly used points are selected and introduced here.